I'm Tricia Bear from the Guardians of Service, and today we have with us Kolby Dilbeck. She's from NeuroLumen from Oklahoma City, and we're here to talk about the NeuroLumen device that helps veterans and civilians with pain management. Good morning, Kolby. How are you doing? No problem. Thank you for coming down and talking to the veterans and civilians about this device, which I highly recommend this device. What three treatments or types of treatments does the NeuroLumen provide?
So the device itself is going to be low-level cold lasers, red and infrared light therapy, and electrical stimulation, all in one pad. So that's the device itself. If you have a pacemaker or a spinal cord stimulator, we take that electrical stimulation out so they still get the benefit of the device. The areas that it can be treated, pretty much head to toe on the body, nothing over the thyroid, nothing over the heart. If the patient has active cancer, they need approval from an oncologist. But really anywhere that there's pain, it can be used.
Okay, so you said not on the thyroid and not on the heart?
The heart, yes ma'am.
Okay, gotcha. So you don't use it on those two areas, but
Yes.
you can use it every other area. The other thing on that, on the NeuroLumen, is pregnant ladies cannot use it.
Yep, if you're pregnant, you can't
So
use
if
it.
you're pregnant, you have cancer, what's the other one?
So pregnant, cancer, or if you...
Pacemaker?
Yes, if you have a pacemaker,
Okay.
you can't use the e-stim.
Okay, so that's really the only people that are not supposed to use it. But if they did have a pacemaker, like she said, she can take off the electrotherapy part
Yes.
of that device. And mainly, did you bring the device today?
I did not bring one.
Okay, that's okay. Basically, it's a device with different cables that go to different pads that you can use anywhere you want on your body. Some are multiple pads,
Yep.
2 pads, some are single. If you have migraine headaches like I do, it's not unusual for me to have 3 headaches a week.
Right.
So you can use the one device for headaches, and it doesn't have all 3 of the treatment
Correct.
therapies, right?
Yep. It's just the lights and lasers only.
Okay.
So with that, we don't want to use any electrical stimulation above the head.
Okay, so no electrical stimulation above the head. And then if you do use the headache pad, just make sure that you don't get the red light going into your eyes, so make sure it's high up on your forehead. I usually wear a hat when I'm using the headache pad.
Yeah.
So, okay. What insurance provide coverage for NeuroLumen device?
So for our veterans, it's at no cost through the VA. We do have an insurance specialist. Her name is Robbie, and she has a list of everything that private insurance does cover.
Okay, so she has a list of everything that private insurance covers. And then on the veteran, so if you are eligible to go to a VA hospital, what you have to do is get a consult through your primary care doctor to the pain management clinic, and then they will call you and set you up an appointment to get treated with this device. So you have to at least get 3 treatments with this device, and if it helps reduce your pain level, then they're actually going to purchase this device for you and mail it to your house and show you how to use it. So if you're a veteran and you're suffering from pain of any kind, whether it's headache, neuropathy, whatever, give your VA primary care manager a call and get that consult through your pain management clinic.
Yeah, that's perfect.
Okay. And then how much does the NeuroLumen device cost with just 2 pads and with multiple pads?
So it really depends. Our device starts at $900, and then it goes to around $4,500, and that is with every single thing that we have. Again, through the VA, it is at no cost. So the price of it, we do not want our veterans to really have to worry about that. And it's the prosthetics department that purchases it. So it starts at those prices. It just kind of varies. For the device and 2 pads is about $1,200 to $1,400. So it really just depends on the pad, things like that.
Yeah, and how many pads you order.
Right.
And also the VA, they will also pay if you wear out your pad, which they're highly sticky, so they're very sturdy. If you do wear out your pads or you need to purchase more batteries for the device, then the VA will also pay for that. You just call the pain management clinic and they'll order the battery and the pads.
Yep. Your providing doctor will be your contact for that.
Okay. So how often can I use the NeuroLumen device?
So what we recommend is twice daily for 12 to 14 days, once a day for a month, and then as needed. It really just depends. So the electrical stimulation of the device is at 2 hertz, so it mimics a fast-paced walk.
Okay.
So it's going to be like a pulse so like a heartbeat. Since that does mimic a fast-paced walk, you don't want to overuse that because it can make the body feel fatigued. So what you'll do is you can use that electrical stimulation with the lights and lasers twice a day, so for an hour. If you want to use it more, you're more than welcome to. What we always say is ask your provider at the VA what they would like for you to do. A lot of the times they will say, just use it twice a day, or they'll say, use it however much you want. Just don't overdo that electrical stimulation because we don't want that fatigue to happen.
Yes, and the device itself is not painful. The most painful part of it is taking the little pads off. Just take them off slow. But the device itself is not painful. I've been through electrotherapy, reflexology, massage therapy. It is not painful at all, honestly. Okay, and I think we just kind of covered that. It is safe to use NeuroLumen as often as you need, or basically as often as the your doctor prescribes it to.
Yes. Mm-hmm.
Yeah, so it's up to your doctor how often you need it for whatever conditions you're trying to treat. How long do the gel pads normally last?
So the gel electrodes are going to last around 3 to 6 months. The device itself can last you forever, as long as it's being taken care of the proper way. So those gel electrodes that are the super sticky that you talked about, those will last that 3 to 6 months, depending on everybody's body. So if you have somebody that has a little drier skin, it's going to last closer to that 3-month mark.
Okay.
But they're $7 a pad, which is really great. And you ask your providing doctor to order them if you need more, and they will.
Okay, awesome. All right.
Most of the time, they will.
Yeah, most of the time they will. So if you're in pain and suffering, there's no reason to be suffering when you have the NeuroLumen device that the VA will provide for you after 3 treatments, and if it's working for you. How do you clean the gel pads, the NeuroLumen gel pads?
So they're water soluble. So after every use, we have refresh spray, and it's a little bottle of green spray that comes with every device. And you're going to spray that twice just on each gel pad, and it's going to keep it hydrated.
Okay.
The device itself, each pad is made with microderm, so it's going to be really easily to clean. So if you have some rubbing alcohol, you can just do a couple sprays of that,
Okay.
and it'll kill everything on it.
All right. So basically you wet the gel pads with water, or can you use soap on it?
So we don't want to use soap because we don't want to break down that pad.
Okay.
But water is the best bet.
Okay, and just wash it off with your fingertips, correct?
Yep, you can do that.
All right, and then on the gel pads, did you say they were $7 a pad?
$7 each pad.
So they're $7 a pad, and they must be ordered in sets of 2. Is that correct?
Yes, ma'am.
All righty. And then what happens if I use the NeuroLumen treatment device too long? That's when you were talking about the fatigue of the muscle, I guess?
Yes. So the lights and the lasers are not going to do anything for using it longevity for pain. The only thing, the electrical stimulation, since it contracts that muscle, it's going to make your body feel like you did a 30-minute walk multiple times. So it's not going to cause any irritation unless you're dehydrated. So stay hydrated whenever you're using the device. But also if you're using too much electrical stimulation.
Okay, and what she was saying earlier is that if you're dehydrated, you may need a number lower than you did the day before, because you're going to use these buttons to adjust it to whatever pain level not really pain level, but the pulse level of that device of what feels comfortable to you. So if you're not as hydrated, you're going to use a lower number on that device, correct?
Yes.
Okay. And then how quickly will you see a difference once you're using that device? So
it really depends. Every body is different, and this is what I tell all of my veterans and all of my providers. Every single person is different. I have had veterans that have no feeling in their legs and their feet, and they have full neuropathy. And an hour a day, 3 days a week for 15 days, they have full feeling back. I have veterans that see their toes twitch with neuropathy. I actually suffer from migraines, and it will help my migraine right after I use it. Wow. So it really just depends. So we always say the more you use it, the more it's going to work. You need to use it the right way. But it's not a magic wand, and that's what we wish that we could give every single veteran a magic wand for all of the pain to go away. That would be our dream. But since that's not realistic, this is something as a tool to use and to help with everything else your doctor is providing you with.
Yeah, so basically to cope with your pain and have a good quality of life and learn how to manage that pain. Because for me, I'm one example of this device. It's 9 years ago. I was having a meniscus tear surgery by a doctor, and he cut my femoral artery in half during the process. However, they did not know he cut my femoral artery, so I went back to the doctor 2 days later because I was in severe pain, because I had already had surgery on my right knee in the military, so I knew kind of what to expect, but this was unbearable pain. So I go back to the doctor 2 days later, and they took me by ambulance to OSU Medical Center in Tulsa. And what they found out 2 more days later is that they cut my femoral artery in half 4 days earlier. So I had to have emergency repair surgery on my leg, and they had to take a vein out of my leg to repair my femoral artery, which caused me to have permanent neuropathy in my foot and my leg. And so my leg for 9 years has been numb for 4 inches above my knee down to my toes. So I wasn't having as much pain as I initially did, because when they initially cut it, it felt like I was getting electrocuted all day long. It was the most pain I've ever had in my life. And so after I had the femoral artery cut, I went to rehab therapy, electrotherapy, reflexology, and massage therapy, and it helped some on the numbness in the leg. But when you're numb, your leg is numb, that means your nerves are dying, and you could lose your leg or your limb over that. So you have to constantly find ways to get your blood circulating, and that's where this device, NeuroLumen, helped me. I went to 3 treatments for the NeuroLumen device in Muskogee, and even after the first treatment, when I got up from that chair, I could actually feel my foot for the first time. I'm not kidding.
Great.
In 9 years,
Wow.
I could actually.
That makes me want to cry. That's
I
so
could actually
exciting.
feel my foot, and I thought, this is weird. I feel lighter now. My foot's not numb. I can feel like I can walk better.
Yeah.
And then after the 3rd treatment, it only took 3 treatments, and they treated me for 30 minutes, all 3 treatments. And after the 3rd treatments, now I just have a little bit of numbness in my toes, at the tip of my toes, and that's it. So it's totally helping me get my circulation back in my leg, and also helping me with my pain level where I can sleep at night. And I'm very happy about it, because I do not want to lose my leg.
Yeah.
I'm super busy and I don't have time for that. So anyway, it really does work. I highly recommend this device to change your life. I talked to soldiers or veterans yesterday, because I'm a veteran service officer for the DAV and the VFW in Henrietta, and this particular spouse, his husband, died after getting 6 steroid shots in their neck. And I said, I wish I had known you before he died a couple weeks ago, because I would have told him about this device that I think is better than pain pills. It's better than getting the shots, because if you keep getting steroid shots in whatever joint it is, all that is doing is deteriorating your tissue and damaging your tissue. So when you go to get surgery, when finally the shots don't work and you go get surgery, your surgery is not gonna work as well, because your tissue is already damaged. So don't keep taking the pills and don't keep getting the shots. Try this device, and I promise it will help change your life and give you a good quality of life without all that pain. So, and then like kind of what I just said, how do you know it's working? Well, my foot's not numb after 9 years of having neuropathy.
Right.
So that's one good sign. What's another way you could tell me that?
So everything's different. So just like that, like the numbness is leaving your body. So let's say that you suffer from PTSD. If you treat the base of the skull, PTSD is something that is never going to leave. I mean, you will always have it. Your body remembers everything that your brain forgets, and vice versa.
Okay.
And so the lights and lasers are penetrating to that brain stem, allowing the brain stem to relax. So you're still going to have the memories, you're still going to have the triggers, but you get control back of your emotion. So instead of having an episode when something loud happens, or if you are triggered by anger, you obtain the function to say, okay, I'm not in harm's way, this is what that was, and you get to process it. So again, it's not taking that trauma away, but it's giving you the power back through that brain stem to allow that area to heal.
Okay, so basically it's giving you tools to cope with your mental health disorder.
Which is incredible.
Yes, and a lot of veterans even if they never went to a combat zone, I did go to Baghdad, Iraq in 2008, but even if they never went to a combat zone, the military is stressful in itself. So because you only have a certain amount of manpower, but you have all these tasks to do, it's continuous stress when you're in the military. So even if you never went to a combat zone, you could still have PTSD or depression and anxiety disorder because you're used to going 100 miles an hour all the time, which I did for 21 years. I was in the Marines for 4 years and active duty in the Army National Guard for 17. Wow. So I was constantly doing things in the military. And then when I got out, within 30 days of me getting out of the military, I thought, well, I just had all this stress lifted off of me.
Yeah.
I had a stroke within 30 days. And I asked the doctor, they could never really figure out why I had the stroke other than if your body's used to going 100 miles an hour all the time and you stop and take a break, because I've had a couple strokes since then. Wow. It was always when I was on vacation. I had the day off. I went shopping. It was during a time where I wasn't going 100 miles an hour. And so they call that a conversion disorder. Mm-hmm. So just because you're not in a combat zone, you're still having depression and anxiety and stress levels because the military is very stressful. You're constantly trying to get all these tasks done and you have limited manpower. So about 30 days after I retired from the military in 2014, I had a stroke, which I couldn't figure out because I had all this stress lifted off of me from 21 years. But when your body's used to going 100 miles an hour and you stop and take a day off and go on a vacation or go shopping and you have time to relax, your brain is still moving 100 miles an hour whether your body is or not. Right. So I did have a stroke and they could never really figure out why, but I was taking gabapentin, and I don't like gabapentin because once I had the stroke, when I researched that, I found out there's thousands of people that have had gabapentin. The VA prescribes it all the time. I do not recommend gabapentin because it did have me cause a stroke, and there was no other reason for me to have a stroke. So that's why I'm really happy about this device, because it'll help me. I have severe migraine headaches also. Yeah. And it's nothing for me to have a headache for 3 days in a row if I don't take my Zolmitriptan as soon as I know I'm fixing to have a headache, because I always know 30 minutes prior. So I'm not a big medicine person. I don't like medicine because it's only a temporary fix and it doesn't resolve your circulatory issues like a neuropathy gives you. So I'm very happy to find out about this device.
Good. Yeah, and the biggest thing is we want this device to be a tool. So if there are veterans that you do like the medication that your doctor has you on, you can do that and use this. So again, every person is different. You like something and you want to use this device, or use this device instead of using something. Yeah. So as long as you talk to your doctor and you run everything by them, that's the most important thing.
Yes, and if you are on medication, you don't want to just stop taking it. You want to talk to your doctor about weaning you off of it, because that's how you're supposed to get off the medicine. Don't just stop taking it because it could provide or give you suicidal tendencies, especially the mental health medication. So definitely talk to your doctor about that. And then we talked earlier a little bit about, is it covered by the insurance? And that depends on the company, of course, that you're insured by. Medicare and Medicaid, they do not cover the device, correct?
Yes, okay. Not right now. We say it's not a no, it's just a not right now.
Right.
So if there is somebody that has Medicare or Medicaid, what we can do is our insurance woman can file it and see if it goes through. And if it doesn't, then we'll always try again. Right. So our biggest thing is we want everybody to be out of pain. If it was our choice, we would let every single person have it. Yeah. So that's the biggest thing, is we are not going to stop fighting and trying until it's approved. So we're going to just keep going.
Yes, and like she was saying earlier, veterans, if you go to the VA hospital and get a consult to through your primary care manager to the pain management clinic, and you do the 3 treatments, and you can do them once a week or you can do them every other week, whatever is convenient for your schedule. You can get those 3 treatments done, and then the VA is going to pay for your device and the pads. Mm-hmm. So it doesn't cost you anything to at least try this modality and this device to see if it's going to help you. If anyone has any more questions, how can they reach out to the NeuroLumen company?
Yeah, so I am the rep for the state of Oklahoma. You are more than welcome to call me. My extension is 124, but we have over 200 VAs nationwide, so that do provide this device. If you call our number at 405-463-6525, and you can tell the person that answers what state you're with, they will get you in contact with our rep. So Oklahoma, I am your girl. 124 is the way to get in touch with me, calling that number. And if email's easier, my email is kdilbeck@neurolumen.com.
Okay, and then is this the website, the customer service at neurolumen.com?
Yes, so that's just the general website.
Okay.
And if you have questions or they want to email in, you can definitely do that.
Okay, and then if they're a civilian and they do buy the NeuroLumen device, is there a warranty that comes with that device?
Yes, so being a civilian or a veteran, there is a year warranty.
Okay.
So anything that happens that is non-cosmetic, it can be covered and fixed. So if you have a pad that's fraying, or the lights and lasers stop working for some reason, or the device just doesn't hold a charge, what you'll do is we'll have you send it into our company. We will take a look at it, then once it's fixed, we'll send it back.
Okay, so the device itself, they'll give you a user manual on how to use it. So it has 4 different plugins that you can use. So if you have dual pads, 2 pads together, they go on the outer part of the device. Is that correct?
Yes,
okay.
So it's gonna, I should have brought the device. I didn't even think
That's
about
okay.
that this morning. I'm so
I was
sorry.
going to bring mine if I'd got it. It's on its way.
So it's going to say A, B, C, and D, and you're going to have 4 arrows. Those 4 arrows are going to go through the 4 ports at the top of the device. So 2 large ports, A and D, and the smaller ports are B and C. So our mega pad, our dual pad, those are going to be on the bigger ports, so on A and D. The single pad, single mini pad, those are going to be on the B and C.
Okay, and then how you take the cables off, because you don't want to pull them too hard, you want to push them in at the end of the cable where it's attached to the device, and that's how you get those cables off. On the display panel, it does tell you if your battery is getting low. What else does it tell on the display panel?
It's going to be a 30-minute timer.
Okay.
So it does have that 30 minutes on the device. The device is going to turn off itself once that 30 minutes timer is over.
Okay, so wherever you decide to put those pads, and then you can rotate them or however you want. So say I was putting the pad on my hand. You can put the pads on your hand, and then there's these wraps that actually go around and secure it. The sticky part of the pad, it's highly sticky, so it's going to stick to your skin, but then you have that wrap as to secure it to make sure it's tight enough. Because if you don't have it tight enough, I believe a light blinks on the device.
Yes.
But it's still working, but you, like, depending on what area you're treating, like my hand the other day, you may not be able to get it, you can only get it so tight.
Right.
So it's going to blink, but that does not mean it's not working.
Right.
It's still working.
Right. The lights and the lasers are the biggest formula for this device.
Right.
The e-stim is just a little cherry on top.
Okay.
So if you don't feel the electrical stimulation like our pacemaker patients and like our patients that do have spinal cord stimulators, it is still working.
Okay.
It's just low and slow.
All right. All right. Well, thank you for coming down. We really appreciate it because it's going to help a lot of veterans, a lot of civilians using this device. I plan on using it every day when I get it. For one, to make sure I don't lose my leg and I keep that circulatory system going. Yeah. And I'm definitely going to use it for my migraines because that's the only problem that I have that's really debilitating to me is when I have a migraine, I'm done for the day unless that migraine goes away. Yeah. So I'm very happy to have this device and use it because I think it's going to really change my life. I do a cooking channel every Sunday at 2. And we do a Guardian of Service podcast at least once a month, and I'm also a VFW DAV Veteran Service Officer. So if you're needing help with paperwork, I represent the DAV and CREBS, and I will help you do your paperwork for VA benefits for free. It does not cost you $1. I help you until we get you the benefits that you deserve. Even the dependents. If the dependents, if you pass away, we help your dependents get the dependent indemnity compensation. I fill out the paperwork for them, and also if they're eligible for DIC, then I also help them get the CHAMP VA insurance that they're allowed to get if they're eligible for DIC. So if you need my help, call me at 479-414-0952, And my office is right here in Henrietta, Oklahoma. Believe it or not, I have veterans come to me from all over the state, Grand Lakes. There's 20 towns in this area that a veteran has come to see me. So, and I'm usually booked up for 2 months, but I try to get you in within the first week to get your date started with a letter of intent and appointment of service officer. And then I have you come back to the second appointment, and I'll spend 2 or 3 hours with you, whatever it takes, to make sure we review your medical records and any conditions that you have, and make sure that paperwork is correct. So you're not going to be in my office 10 minutes. I promise you're probably going to be there 2 to 3 hours on the second appointment. So I'm very thorough on my paperwork. So we're here to help you get your benefits. We want to thank you today for watching Guardians of Service.